Thanks, Raj. Thank you. Let me just get set up here. Yes, so as Raj said, I'm Dr. Mark Savant. I'm a primary care internist here in San Francisco. And I've been in primary care for about 15 years, actually almost 20 years. And diabetes is near and dear to my heart, family members with diabetes. And I've seen it grow in my practice over the years. And I've always been interested in technology and different ways to improve the lives of my patients. And I was approached by First Mile Care to come and do a pilot project with them. So First Mile Care was designed to address the idea of prediabetes. So those patients who have diabetes, who have the signs of hypertriglyceridemia, elevated hemoglobin A1C, and obesity, and you know that diabetes is coming down the road for them. We know that there are 84 million people in the United States with prediabetes. As you know, this will cost lots of money over the years, and there hasn't been any real way to treat them. So Congress actually spoke to the CDC and tasked them with developing a program for stopping prediabetes. And they came up with a diabetes prevention program that involved direct counseling and coaching with patients in small groups with a counselor. And so it was proven to be successful, but the problem was that it couldn't be scaled. And so the founders of First Mile Care worked with the CDC and the AMA to develop this program. We know that the people with prediabetes, over the course of 5 years, 15 to 30% of them will develop diabetes. And really that 70% of people with prediabetes over the course of their lifetime will develop frank diabetes. And so what is this program? We know that these diabetes prevention programs work, and how do they work? First, they start off with small groups with a counselor in weekly sessions. First Mile Care set it up so that people will meet once a week over the first 6 months for about 16 sessions, and then in the second half of the year, they will meet once a month. They are given action plans, and are tasked with coming back and talking with their other members in the group and with the counselor about what to do. And they're critiqued actually by their peers. What I've seen in my own practice is that other than the physician being the most important factor in getting people to move, it's their peers who will get them to move. I remember one of my uncles was a college professor, and he told me in college, he said, you'll learn a lot in your lectures, but where you'll really learn is from your colleagues, from your peers, your other students. And that's what is happening in First Mile Care. One of the things that they're trying to do is to change their behavior. And the behavioral changes can come obviously from diet and exercise, but it's done in such a way that the patients are not going to a gym. They're not in strictly a weight loss program. This is really looking at how to change their behaviors. And we know that the behavior changes work. It's been clinically proven. There was a study done in 2002 in the New England Journal of Medicine that showed that lifestyle changes, and especially with direct coaching, reduce the risk for pre-diabetics to become diabetics by 58%. This was better than placebo, obviously, and better even than starting them early on metformin. In fact, it was so successful that the CMS agreed to cover it as the first preventive coaching program ever and assigned a CPT code for Medicare for this. Private insurances have also followed along. Now, when people get enrolled in First Mile Care's diabetes prevention program, they don't have to have insurance and they don't have to use their insurance. First Mile Care is covering all the costs for this program. When the founders of First Mile Care were addressing this problem, they wanted to answer 3 questions. And the first question was, will the physician prescription increase the ability, or actually, will it increase a person's likelihood to sign up for the program? We found that to be actually the case. The second one is that having a convenient location and a convenient time, or a flexible time, will that make it more likely that somebody will sign up? And the third thing is that if somebody is in a group with people like themselves, someone from their neighborhood, or someone who's culturally like them or speaks the same language, will that make a difference? And we found all those to be true. And, okay. One of the interesting things we've seen is that it is, First Mile Care was started actually by marketing people. Those people who can manipulate you to choose which thing to buy in the grocery store. They were the ones who actually came up with this idea of finding something convenient and local. My practice here in San Francisco was used as the first pilot. And because working directly with physicians, you were able to find those patients quickly and get them converted over into the program. So after those patients were found, the map of the city was made so that they could find the convenient locations for these patients to go. And then after that, we got actually quite a few people enrolled. First Mile Care identified over 500 of my at-risk patients, and they did the outreach on my behalf. They were really respectful of my time and the time of my staff. They would give me weekly updates, and it was actually a very seamless sort of program. I have done other work with other small startups, and it was never this smooth. So I was very pleased with that. They signed up 10% of these patients within the first 6 weeks, and now that first group has completed 18 weeks of the program, and most of them have reversed their diabetes, their prediabetes, whether they're lowering the A1C or losing weight. Again, not a weight loss program, but it was very helpful. And so what I see First Mile Care is as an extension of my practice. I can tell people every day, oh, you should do this, you should do that, but I can't see them every week. And First Mile Care and their coaching, being respectful of my time, has been an extension of my practice. Actually, sometimes too, I think it makes me look smarter than I really am. My patients are very appreciative of that, and I'm looking forward to actually helping them move this to other physicians, because really it's the physician and the physician's relationship which is being leveraged by First Mile Care, and it's the most important factor in getting somebody to change their lifestyle. Good. Any questions?
We'll take 2 questions here.
Yes.
So you're the first. Are there how many others?
Okay, so the question was, I'm the first pilot for First Mile Care. Yes, I'm the first. There are others that are being looked at actually now in Houston, working with a larger health group. Yes?
There are multiple companies which have done for diabetes to get to pre-diabetic stage, where they've reversed diabetes. You know several of the
Yes.
of them are going public this week, I believe.
Yes.
And so, how are you going to provide scale to the business? Whether your model is going to be a franchise where you're going to sell it to the physician offices, or how is it going to be a business model?
Well, the model really comes. Oh, I'm sorry. So the question is how are we going to scale this to either sell it to physicians, and in competition with some of these other companies that are out there that are addressing diabetes, some of which I have done a little bit of work with before too. Yes, and so really the leverage here with First Mile Care is getting people onto the program, seeing knowing that CMS actually already pays for the program. The physicians themselves won't be directly compensated, but the patients themselves will have the opportunity to go and have it covered by Medicare or their insurances. And for any future plans of what to do with the program, I would actually defer to my colleague Andrew here.
I would say off the bat, the companies you're referring to, they're leveraging, well, one, Omada doing a digital therapeutic, and we've seen how well that engagement is, one, just to make the sale, to the clinician, then the patient, and then the retention. And then on the Livongo side, they're a diabetic management company first and foremost. They're only moving into the pre-diabetes space with digital therapeutics just because it's what the employers want. It's a tick-the-box type of thing. So it's digital engagement as opposed to this very service-oriented, convenient approach to diabetic or pre-diabetic care.
Okay.
Thank you.
Thank you.